Thank you everyone for coming today. My name is Hannah Wickern and I work alongside Sarah at the Intertribal Council of Michigan, public health specialist and a project manager for this project. So we're excited to be able to, one, introduce the project for those who weren't able to attend or see our informational webinar that is available on our website. But I'll be introducing it a little bit during this presentation as well. There are funding opportunities that come with this project that I'll breeze through as well. And I'm hoping that we can share some best practices or lessons learned when it comes to vaccine event or vaccine clinic hosting and planning. So exciting stuff. Our agenda today will, like I said, we'll go over a brief description of the Tribal Vaccine Equity Project. We'll be reviewing the Toolkit, which is community-based COVID-19 vaccination model. We found that to be a very comprehensive toolkit, and it can assist with hosting events to administer vaccines. So best practices will be discussed when it comes to providing education and outreach for those events. And we'll talk about sort of the medium walk-up clinics as we've shied away from those mass vaccine events like we saw earlier in the pandemic. And we'll, like Sarah said, we'll make sure to save enough time for questions and then maybe share some challenges that you all have faced when it comes to planning an event. I want to take the time just to get a little bit of feedback from you all. And Sarah, if you don't mind, I do have some polls. If you could go ahead and administer the first poll there.
Yes. Let me know if you guys can see this.
So I just wanted to get a good sense of who is on the call today and has your organization hosted a COVID-19 vaccine event. So if you don't mind answering just yes or no, it's good feedback to have and I can kind of navigate our conversation. So go ahead and vote and we will get that. And I've got a couple other polls, so we'll move through these pretty quickly. So just a yes or no, and then we'll go from there.
I think we got everyone on this one, actually. I just realized there's some extra spaces for you, probably you and me that didn't answer.
So if you don't mind sharing those once you get them, Sarah.
Share these results. So it looks like almost everyone answered yes.
Yep. So that's really good feedback to have because then we can learn from each other and hopefully share some of those ideas. So the next poll that we have, that one asks about, have you hosted any other vaccine events? So maybe something like HPV or flu. Let's go ahead and answer those. And then we'll go ahead and finish up with the third one. Keeps coming.
Awesome. We have a lot of experience in this group.
Great. And then the last question I have is, did you have any challenges with hosting either of those? Or excuse me, for hosting COVID vaccine events? Did you run into anything that you would have done differently? Any challenges? And that's just a quick yes or no again.
Thank you for
Perfect.
answering all the questions.
Yeah, so it looks like everybody has faced, not everybody, but most people on the call today have encountered some challenges or maybe something they would have done differently. So hopefully in today's presentation, we can talk about those and then share some of the best practices that this toolkit highlights and experience that we've had. So we'll go ahead and close out of there and jump on to our next slide. Before I dive into the toolkit review, I just want to give a brief overview of the Tribal Vaccine Equity Project. So this is a national scale project hosted by the Intertribal Council of Michigan, and it is funded by the National Network of Public Health Institutes to, build national infrastructure in order to mitigate COVID-19 within racial and ethnic minority communities. As you can see here, the overarching goals of this project are one, to reduce COVID-19 vaccine hesitancy, increase access to the vaccines, and then ultimately increase vaccine uptake. Through this project, the Intertribal Council of Michigan is providing tribes nationally with opportunities to reach those goals with monetary incentives or awards attached. So it's hard work and we recognize that, and we want to be able to support it in ways that you know how to meet your community best. So things that are involved are healthcare provider trainings to address hesitancy among your patients and maybe community members, promoting vaccine education materials, hosting virtual events or maybe even in-person events to address vaccine hesitancy, and then supporting partnerships with community businesses and organizations to host vaccine administration events. And that's going to be a lot of what we're talking about today. So like I said, the project has funding opportunities available, or awards as we've called them, for 10 tribes, tribal health centers, or tribal serving community partners in 4 different categories. So on our website, you can see the breakdown much clearer than on this quick slide here. But you are able to apply for all 4 of those categories with a total award amount of $26,500, or you can apply for one of the categories, or maybe you want to do a couple, but not all of them. So there is a breakdown of the awards on the website. And Sarah, if you don't mind, just putting in the chat box the website so people can check that out, that would be great. As you can see, the project period is very short, only 2 months. So these events would happen sometime between March 21st, so last week, and May 20th. And I just want to let you all know that there is a lot of flexibility with how these are run, and especially with reporting. We're not asking for a lot. We know that you know how to serve your community best, so we're hoping to provide these awards in order to do that. Yeah, so there are the 4 different categories, and those can be seen on our website. The one that I'll highlight, which goes along with the information provided today, is community vaccine events. So something where you are hosting a vaccine event where you're actually administering vaccines. These can be primary or secondary doses of COVID-19 vaccines. You're able to submit up to $15,000 to support your event, but please know that you will be receiving half of that award up front to support that event specifically, and the other half once you've completed the event and reported out your, your number of vaccines, and just like a brief interview with one of our staff and how it went, and maybe some lessons learned. So, that second portion of the award can support future vaccine efforts. We don't ask for line by line items. The main goal is just to meet people where they're at. They're partnering with tribal serving businesses or organizations. So that could be something like, partnering with a hotel, or partnering um, with your cultural center or casino, wherever you can meet your community best, that's a great place to partner. Another idea would be if you already have an event happening. I know there's, health fairs that might be happening in person, and it's something where you might want to offer COVID vaccines as well. Or maybe you're already planning a COVID vaccine event. This is a great opportunity to apply for an award and get some funds to support what you're doing. These funds can be used for staffing, for supplies for the event. It is very flexible. So if you do have questions, I'm happy to answer those or talk one-on-one about them. You can apply for the opportunity. We've tried to streamline the application process for these awards. So for this one specifically, we just ask that you provide us a brief description of your proposed event, how you plan to record and report the outcome, and then the number of vaccines you administered with a proposed budget. So like I said, we're not asking for line by line, we're asking for a total that you need to support your event. Like I said, communications materials would be something that you could use the funding for, extra staff support, supplies, anything along those lines. So I hope that gives you a good understanding of one of the funding opportunities that come with this project. This may seem like a silly reminder, and as we kind of dive into the toolkit and best practices, but it's important to remember that vaccines are a leading public health strategy to end this COVID-19 pandemic. And in order to increase vaccine uptake, we must make them accessible to those who need them, and do that with compelling information from trusted sources. Hosting vaccine events in collaboration with community partners is a great way to do that. I think it's important to review this slide from the CDC as you think about hosting an event. Oops, sorry, my computer just glitched out there. When you're thinking about getting those in to get vaccinated, we have to think about where they are on the spectrum. We know willingness to accept a vaccine falls somewhere along the lines of acceptance or refusal. And a lot of times people are right in the middle, and we want to move them more towards the right. People seek out vaccines when they feel confident in the outcome and when they trust where it comes from, and when they have the ability to access it easily. So just something to keep in mind as you plan events or think about planning them. So now we'll take some time in highlighting one of the toolkits that the Intertribal Council of Michigan has identified as being the most comprehensive. It gives a lot of tips and ideas on not only communication and outreach, but logistics, planning, how many staff you might need, what those staff should be doing, roles and responsibilities. It's very comprehensive to the point where we have narrowed down focusing on vaccine information that would be helpful at this point in the pandemic. There's a lot that we aren't in that stage anymore. So it provides guidance on essential components and considerations. Like I said, it recommends staffing, responsibilities, supplies, and even a layout of how you should position your chairs. So a lot of good information. It was created by CORE, community organization, community organized relief effort, and then also Partners in Health, who describe lessons learned from vaccination sites that they hosted in Los Angeles and Atlanta. So I recognize that maybe not all of this information will fit tribal communities, but it does provide some best practices and maybe ideas that you can build off of um, or adapt to meet the needs of your community. So when you think about hosting a vaccine event, you want to outreach. You want to get people involved and identify populations who need to get the vaccine or may be vulnerable to COVID-19. Let's see here. So like I said, you'll need to identify those folks who would benefit from getting the vaccine and then also generate demand for the vaccine. One of the tips that I really like below in this little green box is for helping to identify patients is going through your EHR and maybe you are keeping track of who is vaccinated, pulling those people and sending them a personalized reminder. That could be really, really helpful. Another tip is to offer incentives to draw people in, even if they are just learning about the vaccine. An incentive, allows them to learn more and make an informed decision. And then the other key point here is utilizing trusted messengers to promote the event. Somebody like a healthcare provider. The power of a provider's recommendation is so strong and really something that could be utilized. And then also social media influencers. We know that people from the ages of 18 to 50 are the least likely to be vaccinated. And those people spend a lot of time on social media. So why not put your promotional materials in that realm? I've included just a sample email or letter that you can send to your patients once you've identified them as an eligible vaccine recipient. Other tools that we've seen are personalized text messages if you have access to their phone number and they receive texts, or even just a mailed postcard. So those are great tools that you can use. So once you've identified your population, it's helpful to provide a space for community members to ask questions or share concerns. Events like virtual roundtables or maybe a Facebook Live session have been helpful to facilitate those discussions and address hesitancy. So it's a safe place and they can ask all the questions that they need. And one thing to keep in mind if you are hosting one of these sessions is to use plain language. It's easy to get caught up in the jargon of CDC and all things COVID. So explaining it in a way that makes sense is a really important key piece here. We have, you can see here, a webinar, Why Aren't They Showing Up? A Lesson Learned in Health Communications. This webinar is on our website, on the National Native Network website, and you can see a lot of great tips and tricks that they offer to reach people. I've got a few slides in here that are helpful. So as you create maybe a promotional flyer or a graphic for social media to alert the community that you are hosting these events, you want to make sure to keep these in mind. Put your bottom line up front and think about what your audience is going to see first. What are their eyes drawn to? So obviously here, COVID-19 vaccination event. Focus on the main points, what, who, when, where, and how, and stick to maybe 2 or 3 different font styles and sizes. Less is more with these kind of flyers. maybe using pictures or graphics is a great way to connect, and to make sure you tell your audience what you want them to do. And it's always helpful to have a proofreader who is maybe unfamiliar with the work that you're doing with promoting the event, so that you can have a second set of eyes. I thought this was a great resource to highlight, especially since it's promoting a clinic. So you know what is happening, you know who is eligible, where they go to do it, the call to action, which is how to register. It looks like we have, forms. I think that's Google Forms, really great free resource. And then some clarifying notes if you need to add those at the bottom. Check my chat real quickly. Oops. Give me just a moment here. I'm trying to get this over here. All right. So moving on to the next slide here. So the toolkit highlights 3 different kinds of vaccine events. And maybe you've already done some of these, maybe you've thought about them, but there's the mass vaccine clinic, which is where you're serving maybe 1,000 people in one day. You're administering shots for 1,000 plus people. Then you have mobile vaccine clinics, which is maybe something where you're driving in a van that's equipped to administer vaccines. And then we have this medium walk-up vaccination site. A lot of the feedback that we've been hearing is, you're getting far less interested folks to get vaccinated. So you really do have to meet them where they're at. So just some of the benefits. Site organization is a key planning point. What this toolkit recommends is having an exit and an entrance, so you can create some sort of flow for your patients to walk through. It also helps with social distancing. So you can see here, people move through, they come in one side and they get registered, they have their vaccination site, and then they can be monitored for any adverse effects. So additional sites to consider are within your site are maybe a prep area where you have your nurses or other medical staff preparing the vaccines themselves. Always got to think about restrooms, parking, and then also staff break rooms. So be mindful of those that are helping you out. So to break it down into 4 different categories, you have your pre-check, where patients are welcomed and screened for eligibility, and their appointments are confirmed. Following pre-check, patients will then go ahead and register if they haven't done that already. One thing that we found really helpful was color-coded safety vests, or maybe even color-coded tables. It's really helpful for not only the people at the event, but also your staff and how they direct patients around. And then also, thinking about including parking area for non-ambulatory patients, and that's somewhere where staff can go directly and administer the shots in cars or buses, or however they get there. Like I said, next you have Checkin. So online pre-registration is highly recommended. If you don't do that already, it does save time for your staff. And then it gets people in and out quicker as well. I know Google Forms, SurveyMonkey, Smartsheet, those are all tools that have been used for online pre-registration. This is where you're going to record them in your EHR and provide consent to actually be vaccinated. One of the tips that they highlight is handing out raffle tickets. So these are, they can be used to show, yes, you've been registered, you've got a ticket, and which arm the vaccine is going to go in, and maybe if they need any clinical consultation. So then, of course, you've got your vaccination station. That's where you get your shot. And sometimes people combine some or all of these into one. So maybe that's an idea if you're hosting something where you don't even need a flow. Maybe it's just a one-stop shop. Documenters are huge in this step. They can be really helpful in confirming the patient's name, arm, all the last minute details, and then maybe set up timers for monitoring. Again, for non-ambulatory patients, you want to use maybe a vaccine supply cart stocked with all the equipment and supplies that you need to make that process quick and easy as well. Monitoring and checkout is just somewhere where you're going to monitor the patients. I'm sure you guys all know this, but it's a great time to administer vaccine cards and answer any questions, but also address other health related social needs. So maybe you take the time to screen for food or housing insecurity, making sure they have a primary care doctor. And if not, you have those resources on hand. This could be, a great time if you're hosting an event in conjunction with another event where they're learning about that other event while they're waiting for their vaccine approval. So I just want to highlight a few other resources. This Partners in Health who published this toolkit that we've been talking about. They also have Excel spreadsheets for planning. If you have this many people you want to vaccinate, here's how many staff you need, how to track your dosages if you don't already have a mechanism of doing that. And then the Minnesota Department of Health did a great job with hosting community vaccine events. So just a few resources I thought I'd highlight, but I do want to take the time. I know in the polls that we first created, there were quite a few people who said they had challenges with COVID-19 vaccines. And I just want to see if anybody would like to maybe type in the chat. Maybe you have already, I haven't read them yet. But let's see here. If there's anybody who would like to unmute themselves and talk about maybe some of the challenges that you have encountered with hosting vaccine events, we can talk about those now. And let's see. If you aren't able to unmute yourself, please let me know in the chat and I'll try to figure that out. Okay, we can't unmute is what I've heard. Let's see if I can figure that out. So Sarah's got some resources in there. Sorry about this. If you know how to use the raise your hand functions, go ahead and do that. And I think I can unmute you that way. Let's see here. Oh, there's Betty. Sarah, I think I just made you host. If you could unmute Betty Janke, that would be wonderful. Sorry, I've not had this many technical difficulties on Zoom before. There we go. I've asked to unmute. There we go.
That was interesting. I felt like Zoom got stolen from you.
I know.
Because the chat is disabled as well, so I couldn't even put anything in chat, even if I wanted to.
Okay.
So yeah, I was just trying to like get something open here. What was the question? Challenges.
Yeah.
Yeah, we kind of started out with challenges, and we just learned with each vaccination clinic that we did what didn't go well, and when we did another one, what we needed to correct. So our first vaccination clinic started out relatively small. I think we only had, I can't even remember now. It seems like so long ago, and it's only been 2 years. Or no, only a year. Yeah, something like that. I think we had like 60 doses that we gave, and we were all so like worried about that. And then the next time we were like, oh my gosh, we're going to do 100. I think the worst thing that we did was we started out with lists. We had a list of elders, a list of employees, and we just kind of went down through that list, and we're calling people to see if they were interested. And that's where that really, I think, was the biggest challenge that we had, because for one, we're not getting a hold of people. Number two, you're getting people who are saying, well, I should have been on the list, and they weren't on the list. And then we figure, okay, we have all these 100 people that are coming in, and then you're halfway through your vaccination and 50% of them haven't showed up. So then you're spending another 2 hours on the phone trying to get more people in because you don't want to waste any doses. So once we were like, okay, this is not working out. We need to throw out these lists, and we switched gears. We put it on the person, and that's when we created sign up, or they called to schedule their appointment. Because all of our vaccine clinics have been done drive up style. People stay in their cars and they're just going through a loop. So we go out to them, they wait in our parking lot, and yeah, that's how we did the bulk of our vaccine clinics. And I think that's our biggest challenge. We dealt with wind, rain, snow, sleet. Our employees worked through all of that to get vaccines in arms. So for us, it was the list.
Yeah. And Betty, I know this, but I don't know if everybody on the call knows this. You are working from a health clinic. Had you partnered with any community serving partners or anybody to host those, or did you just do that at the health clinic? Oh shoot, there we go.
We did a couple of clinics within Sault Ste. Marie. Our little health clinic is located out in Bay Mills Indian Community. It's about 30 minutes away from Sault Ste. Marie. We partnered with War Memorial Hospital, which is our local hospital, Lake Superior State University, which is the university that's in the Sioux, and Chippewa County Health Department. We partnered with all of them, and we've provided, I think the most we've done was 12,000 vaccines in one day at Lake Superior State University. That one people actually came in the building. That was one of the few that we've done that weren't drive up. And we hosted 2 clinics with those partners. And then we've done a few where we've gone to local schools. So we went out to Cedarville, did some vaccines there, and we went to Rudyard. And that was partnering up with War Memorial Hospital. But the bulk is right here on the reservation at our elders clinic. We started out as our golf center because it has a nice drive-through parking lot. So we usually use our golf place or our elders building.
Okay, great. Thank you. Yeah, and it looks like this either typing in the chat, I think you can type in the chat now, or if you are able to use the raise your hand function, I can unmute you. I have to know that you are wanting to give some input here. So did anybody have any successes with communicating with their patients that they were, eligible to get the vaccine? Any strategies that you'd like to share? Oh man, this Zoom is really making it difficult. Okay, I think I just found a function that you're able to unmute yourself. So if you want to give that a try, please do. Okay, so in the chat, Catherine, We had posts on Facebook and Instagram to promote dosing schedules. I know the power of social media has been really great during this pandemic. So that's a great way of reaching your community. Thanks for sharing. Anybody else? Maybe things that you would have done differently, whether it's in communications or hosting an event. I know it's all been a learning process. Well, if you think of any, please put them in the chat. I do want to take a little bit of time to see if there's any questions about those funding opportunities that I had mentioned. You know, this is really meant to provide you as a resource, if not only if you're interested in the funding opportunity, but any of the vaccine efforts that you are a part of or maybe are planning on. So any questions there? I will share my screen one more time. If you do have more questions about this project, we have all of our funding opportunities on our website, thiskeepitsacred.itcmi.org/COVID-19 vaccine equity. If you're sitting there thinking, yeah, we've got a vaccine event coming up, or maybe it's something that you're interested in hosting and applying for this award, we've got the direct link here. So you're able to do that, and I'll make sure to send out the slide deck and make the recording available on our website once we've done that. And yeah, really looking forward to any questions. We do have another webinar coming up next week, which is also tied to a funding opportunity if you're thinking about hosting maybe a virtual event to answer any questions. We have engaging your virtual audience, best practices in hosting online events. So make sure to register there.
I put that link in the chat to register too for next week's webinar at the same time on Wednesday. Oh, you can see it here. Yeah.
Yeah, perfect.
We will definitely figure out our Zoom situation.
Yeah, I'm not sure what happened there, but thanks for bearing with us.
Yes, thank you everyone for your patience.
Yeah, so if there's no other questions, I'll leave my contact information here. If you have any questions about the project, funding opportunities, if you want more information about what was shared today, please let me know. I'm happy to talk through that. And yeah, I just thank you for attending and again, bearing with us for whatever that was. So,
Thank you. Have a good day.
thank you.
Thank you. So much good information. Thank you so much.
Thanks.